Hi, I'm Garvin from Lynch's Pharmacy in Douglas in Cork, and this video is about again the coronavirus. So the coronavirus pandemic is making a lot of people anxious. So abrupt changes to our normal life are now being experienced by the majority of the world's population, with over 4 billion people now under some kind of order to stay at home in an attempt to curb the spread of COVID-19 and reduce the deaths by, as the new term, flattening the curve. So, but what about those of us who are doing as much as we can by staying at home and who are not on the front lines, as many are? So experts are increasingly worried about our mental health. So as many of us try to adjust to this new normal, a recent review article from The Lancet aiming to predict how we might fare looked at the psychological impact of previous periods of quarantine on the population due to infectious diseases. So they included diseases caused by other coronaviruses such as SARS and Ebola. The analysis combined data from 24 research papers and found that many of the studies reported negative psychological effects such as anxiety, confusion, insomnia, anger, and post-traumatic stress symptoms. The coronavirus does have the potential to hurt us, so of course we are going to think about it. But anxiety is different to fear, which is more acute feeling of being afraid. So during fear or panic, we might notice that our heart is racing, we're feeling short of breath, like we aren't getting enough air, even though we aren't sick, or we're feeling dizzy or lightheaded. We also talk about anxiety, which are longer lasting feelings of being worried, tense, irritable or cranky, having trouble sleeping, and feeling like you can't concentrate on anything but the coronavirus. Although some people may be very in tune with how they are feeling and able to identify different emotions, some may not be able to so accurately pinpoint why they are feeling a certain way or what even to call it. Although normal anxiety is, however, undoubtedly not a pleasant feeling, and many of us will be looking for ways to try and alleviate symptoms during the coronavirus outbreak. But how can we do this effectively? So at times like this, science tells us that the best strategy is to work on accepting those emotions. So when we say acceptance, we don't mean being okay with things that are happening right now. We mean understanding that yes, things are terrible and scary, and that you and others might feel afraid, angry, sad, and unable to concentrate on anything else. These emotions are normal and they are there to help you. Science, again, tells us that accepting and understanding these emotions as they come is the healthiest thing we can do. So engaging in activities that are important to us is another strategy that science shows is helpful when things become too much. So going for a walk or run while maintaining the 6 feet social distance, calling loved ones, or finding ways to volunteer for your community without leaving your home or putting anybody in danger are all strategies that can help at this time. So how might someone know the difference between a normal anxiety response to a difficult time and a more severe response that warrants seeking professional help? A common way to check your anxiety levels while considering the current very unusual lockdowns in place around the country is ask yourself, does my response feel out of proportion to the situation? The other check is this interfering with my day-to-day life, which can also feel hard to gauge because our day-to-day is so different and upended. However, you are still sleeping, showering, eating and doing your work and schoolwork if you're a teenager, or interacting with others. And any change to feeling able to do those things in the same amount or in the typical routine or schedule would be a warning that you should talk to your doctor. But what about people who were already dealing with a diagnosed mental health condition before the pandemic hit and may be feeling extra strain due to the current situation? So it is absolutely possible that pre-existing mental health conditions can be exacerbated by COVID-19 and self-isolation. Previous studies suggest those with pre-existing mental health disorders might be at higher risk for poor mental health outcomes. So people with pre-existing mental health conditions should be aware of any previous poor coping mechanisms such as alcohol use, eating disorders and self-harm, and pay attention to urges. So for example, the use of alcohol and drugs, and warning signs for worsening symptoms or relapse. People with existing mental health diagnosis should also not stop therapy or medications simply because you are not leaving the house as often. In fact, you might need to rely on them more. While the length of stay-at-home orders increasing as countries deal with increasing cases and deaths from the coronavirus, it is likely fair to say that many of us will be feeling differently to normal and may want to take steps to try and preserve our mental health. Keeping a realistic perspective of the situation based on facts is important. So here are some ways you can do that. Stay informed, but set limits for news and social media. Keep your healthy routines, so your walking and exercise routines. Stay connected to others. Talking to your children and young people about the current crisis. Try to anticipate distress and support each other. And online and phone supports, the use of these has lots of resources. So you go to the hse.ie. They have, again, as I said, lots of resources for people with mental health issues. One final very important point. If you don't feel well or feeling a bit low, contact your doctor. Doctors have not closed down. They are still open for all health issues, not only the coronavirus. Do not try and wait it out and hope symptoms improve. Ring your doctor. On a final note, so this is from Science Daily, which is a website or a portal where scientists publish their research papers. So the following was published on the 2nd of April, and this is a direct transcript. So the University of Pittsburgh School of Medicine scientists today announced a potential vaccine against SARS-CoV-2, the new coronavirus causing the COVID-19 pandemic. When tested in mice, the vaccine delivered through a fingertip-sized patch produces antibodies specific to SARS-CoV-2 at quantities thought to be sufficient for neutralizing the virus. The paper appeared today in Ebiomedicine, which is published by The Lancet, and is the first study to be published after critique from fellow scientists at outside institutions that describe a candidate vaccine for COVID-19. The researchers were able to act quickly because they had already laid the groundwork during earlier coronavirus epidemics. So as the researchers said, they had previous experience on SARS-CoV in 2003 and MERS-CoV in 2014. These two viruses, which are closely related to COVID-19, taught us that a particular protein called a spike protein is important for inducing immunity against the virus. We knew exactly where to fight this new virus, said the co-senior author, Dr. Andrea Gambotto, who's Associate Professor of Surgery at the Pittsburgh School of Medicine. So there is light at the end of the tunnel. All is not lost. And we are well on the way to developing a vaccine, which will finally, and once and for all, bring this nightmare to an end. So in the meantime, stay calm and stay healthy and maintain social distance. Regards, Garvin.